An ex-offender support network in Singapore is looking to partner the health sector to help care for elderly former inmates. This in hope of providing stability as they enter their silver years. The proportion of inmates aged 65 and above here has doubled between 2020 and 2024, reaching 8% or 574 inmates in 2024. Now, the move is part of a new 5-year plan to strengthen community support for ex-offenders through a care network. The plan also includes helping members of the network better support ex-offenders with jobs, upskilling and financial management. Law and Second Home Affairs Minister Edwin Tong said the network has played a big role in reducing recidivism rates in Singapore since it was launched 25 years ago. The 2-year recidivism rate dropped almost half from a high of more than 40% in 2000 to around 21% for the 2022 release cohort. He said this rate could still be lowered through a stronger aftercare ecosystem.
We want to cultivate new partnerships, including with partners from other sectors as well, to more holistically address the needs of inmates, ex-offenders, and their family. As society evolves and grows, so must this network, because this network must represent something that is close to or commensurate with the real society that ex-offenders come back into and want to be reintegrated into. So the more we are growing, the more we are evolving, the more relevant it will continue to be for our inmates.
Mr. Tong was speaking at an event to mark the 25th anniversary of the Care Network. For the next 5 years, it also seeks to streamline programs and services and implement more cross-sector mentorship programs. The support network currently has over 170 community partners. It trains more than 4,000 volunteers in areas like addiction treatment and family support. More than 100 former offenders are now volunteers to help their peers exit crime. Yellow Ribbon Singapore has also partnered over 6,700 employers to provide jobs for ex-offenders. It is the lead agency in reducing recidivism through skills training and career development for ex-offenders.
So when an ex-offender comes out of prison, if he doesn't get employment support, if his family doesn't support him, or even if the community doesn't give him a second chance, he will struggle in his desistance journey. Yellow Ribbon Singapore will continue to widen our network of stakeholders, including reaching out to corporates, partners and employers to promote inclusivity and second chances.
And here to share more about their plans is Justin Vigneswaran. He is Senior Assistant Director of Community Partnership and Family Policy under the Rehabilitation and Reintegration Division at Singapore Prison Service. Welcome to the program, Justin. So, as we understand, the proportion of elderly inmates has doubled since 2020. So how important or urgent is it to introduce this framework at this juncture?
So, as you rightly pointed out, the elderly inmates, we are actually seeing more of them within the prison system. So, the aftercare support that they require would be different from ex-offenders who are younger in age. So, we are looking at support in the form of healthcare support. So, for example, we are seeing more of them having issues like dementia, for instance. So, these are areas which require specialized support and follow-through. And over and above that, they also need to be actively engaged. We are talking about active aging for such profiles of ex-offenders. And we are also looking at accommodations because they need to have accommodations issues to sort it out as well.
So earlier you were talking about specific challenges that elderly inmates face. So what unique challenges do elderly ex-offenders face upon release that younger inmates might not?
So I was talking about healthcare issues mostly, things like dementia and things like physical issues, mobility issues that younger offenders would not have. So when they are moving out into the community, we need to ensure that they are able to carry on with the normal life routines. So these are issues that require specific care and support. So we actually intend to collaborate with partners from the healthcare sector to address these issues.
Okay, and this is also part of a 5-year plan to strengthen community support for ex-offenders. But how would SBS assess the success of this network? Are there tangible goals or figures, numbers that you are aiming for?
I think the Care Network is aiming for two areas. One is to actually bolster the aftercare ecosystem And when you're talking about tangible results, we're actually looking at the recidivism rates. So what started off when the care network was formed in 2000, it was around 40.1%. And the latest recidivism rates figures has now declined, slowly improved to 21.3%. But we think more could be done. Because if you stretch beyond the 2 years and look at a 5-year recidivism rate, the latest 5-year recidivism rate actually stands at 36.6%. So it is actually more. So we're actually having more offenders who come into the system in the span of 5 years. So I think the challenge is to actually have sustained continued support for ex-offenders so that they stay successful beyond the 5-year mark, that they don't return back into the system.
And one of the goals of this network is also to streamline your programs and services, to implement more cross-sector mentorship program. Could you also share some examples with us of duplications in services and programs that you've seen over the years, and how does SBS hope to overcome this problem?
A little about the cross-mentorship initiatives. What it actually does is to help with the transference of skill sets and transference of knowledge. So one of the things that we are looking at is to actually second officers within the care network. So they bring with them those knowledge and skill sets that they have from a particular organization and bring it over to another organization where they can collectively upskill the knowledge and skill sets, capabilities and competencies, if you will. I'm sorry, what's that again?
The other one was the duplication of services and programs, right? How do you overcome?
So with the 170 community partners that we are working with right now, they are actually very diversified. We are talking about faith-based organizations, we're talking about halfway houses, talking about schools and social service agencies. So when you look at them across and you actually realize that actually there's some services and programs that are being provided which are actually duplicated. So we're actually looking into making them complementing each other rather than duplicating it. So there is a care network steering committee, which is represented by core members of the care network team. And they are facilitated by the secretariat team, which will actually be looking at the landscape of the aftercare services provided and see which are the areas that are duplicated. And over the next 5 years, the course of 5 years, we're looking into making it more streamlined and more effective. Yeah.
Okay, it involves a lot of stakeholders at play. So beyond duplication, are there other challenges within the aftercare ecosystem that the new framework wants to address or wants to tackle?
I think at this point in time, we understand that employment and accommodation are issues that we need to sort out for ex-offenders. But the Yellow Ribbon Singapore has done extensive work with regard to addressing the employment needs. And we have worked closely with the MSF as well to address the transitional shelters for ex-offenders. But we think more could be done in terms of more coordination so that the support goes out to those in need in a timely fashion. So I think that's the area of issues that we need to sort out. Yeah,
Justin, I wish we had more time to talk about this, but thank you so much for coming in tonight.
Thank you so much, Rashida.
That was Justin Vigneswaran from Singapore Prison Service.